There we go. So we're going to talk about hormone replacement therapy. Is it a wise idea for women in menopause, or is it foolish? And not just women, there's going to be a little nod to men at the end of it. And I think of this, what we've been focusing on in these Zoom meetings is my insights about the confusion that we're trying to sort through about the coronavirus and how you can stay healthy at home. And we will get back to that because that's going to be really important over the next year. But I also want to attend to controversies in health, things that we talk about that you may hear one answer at the co-op, one answer from a naturopath, one answer from your sister, and a different answer from me. What would you like us to juggle with? And this is the first one we're doing, hormone replacement therapy, because I have a patient who went to a local presentation and said, I heard hormones are not good for you. So we're going to talk about it today, but what would you like us, besides this or next, what other controversy would you like us to address, if any? Although I work at a place that is called the Memory Center, I'd say what's common to all my patients is they're interested in improving their health, and that has always been true. And even when I was more of a purely homeopathic practitioner, I've been interested in replacing women's hormones in menopause. I realized I've been doing that for more than 25 years, which means I was doing it in the previous century. That's pretty impressive, isn't it? So I've had a lot of women tell me that somebody, after I started them on hormones, tell them it's a crazy idea. And I just want to give you, if you haven't heard me explain the background of how I think about it, and really why I would even think about it for women in our history as women. And then the context, which will include references to the scientific dilemmas about hormones. So we are a unique species. We are who we are because of evolution. We are the hominids, that's the category we're in, who evolved millions of years ago and survived. We're not the ones who evolved, like the Neanderthals and some hominids, and didn't survive. We're the ones who survived. And we survived, creating in our species, unique among mammals, unique, the process of menopause. Dogs don't go through menopause, except when we fix them. There is no natural mammal that goes through the cycles we go through, gives birth to live children, and then stops to have an era where they can be without fertility. And how I think of it is if you had two competing bands of hominids 2.5 million years ago, and they tended to live, they either died really young or they lived till about 60 to 70. The ones who kept having babies the whole time wouldn't do as well. Like I, at my age, would love to hold a baby and then hand it off to the mother and leave, and thank God I'm not giving birth at my age. So menopause was very useful to the tribe millions of years ago, but men could keep their fertility and their hormones for their whole life. Women's hormones indeed are lost, I believe, for the benefit of the tribe. And the ones we lose are the ones that come from our ovaries. And so that's the bulk of our estradiol, progesterone, and even our testosterone. We still make a little bit in our adrenal glands, but nothing like what we have as cycling women. And what happens? What price do we pay for that? It's a pretty, women go to doctors more than men do anyway, but it's certainly a time that a lot of women either talk to their friends or talk to their doctor. Oh my goodness, I'm beginning to have terrible hot flashes and insomnia. I'm just not sleeping as well. And that is the first and main chief complaint of menopause. It has been downplayed in science for a long time. It was about 3 years ago that somebody did a study and said, hey, you know what? We've been telling women that this isn't going to last for more than a couple years. And for some women, hot flashes and insomnia lasts the rest of their lives. Alzheimer's disease, 2 out of 3 Alzheimer's patients are women. You're twice as likely as your male cohort to get Alzheimer's disease. And the belief is now not that women chew more gum or eat more sugar or anything like that. It's that we lose the hormones, and our brains actually like the hormones. Women are also twice as likely as men to get osteoporosis. And to me, of all the things I'm going to list here, this is most often actually the most tragic diagnosis, because you could take somebody, you know, I'm 72, I'm really healthy, I'm not going to have a heart attack, don't have Alzheimer's disease, I take good care of myself, but if I had osteoporosis and didn't know it, I could slip on the ice, fall and break my hip, and my life would never be the same. My hip may never heal. I may get an infection while I'm in the hospital. It's about 50% of people that have a moderate to severe complication of their hip fracture. So this is a big one for me, and I like to check bone density in women and recheck it every few years, and I like to do it in older men as well. They're not as common, but they do get it. We're more likely to get heart disease. Up until our 50s, we are like golden, and men start having heart attacks, and we like have perfect hearts, and we don't have high blood pressure, and we don't have heart attacks. It's changing a little bit now. The modern world's a little different, but when we enter into menopause, so you can see men's heart attack risk goes like this over a life, and ours is kind of constant. And then when we go to menopause, ours starts increasing with men's and typically doesn't catch up, but it can. You may know that if you think about it, people as they get older, you see more of their teeth. And when they go to the dentist sees more problems. Your gums start receding. Your teeth get looser in your mouth. You stop chewing. Chewing is one of the things that prevents you from getting Alzheimer's disease. I'm going to say that again. Chewing is one of those things that prevents you from getting Alzheimer's disease. You do not want to drink all your meals. Besides, that doesn't sound very appetizing. So gum and dental issues are a symptom of having low hormones. And the one that's the biggest concern to most people is breast cancer. You know, even though we are more likely to die of heart disease or osteoporosis, the disease that bothers us the most, that scares us away from hormones and maybe sends us to the doctor the most, is breast cancer. Well, what if Big Pharma thought we could replace the hormones that women lose in menopause? Oh, that would be so kind of us. You know what? I want to take a little interlude. You may, if you know my speaking style, you know that sometimes my mind says, ooh, I want to share with them something new that doesn't really relate to the topic for today, but does relate to the term I just used, Big Pharma. In this seminar that I went to over the weekend, Friday and Saturday, I saw this slide for the first time. We are quick to judge Big Pharma in the lower right-hand corner of your screen as corrupt lobbyists filling the halls of Congress, influencing legislation, and how medical care is decided in this country. You know how medical care is decided in this country is by the column off to the far left. Agribusiness and big food have a far greater influence in Washington than Big Pharma does. That means they make sure that Cheerios are labeled heart healthy. Why does my computer keep doing that? I have an idea. Agribusiness and big food are way more who we need to look out for than Big Pharma. Not that I consider them my best friends, Big Pharma, but they did come up with a plan to treat menopause. And they first thought, well, you know, the main hormone that you lose is the one that you had all your life, which was estrogen. If we just give you estrogen, we can't patent it. Maybe that's what they thought, or maybe they just thought they'd rather make it from horse urine and make Premarin. And so in about the 50s with People writing it was the fountain of youth for women. Women started taking Premarin. They loved it. Oh my God, I've got my brain back. I've got my sexual energy back. I'm a woman again. I don't have periods. This is really the best of both worlds. Oops. A significant proportion of those women who just took estrogen got a cancer in the lining of their uterus. You can't just constantly bombard hormone-sensitive tissue with estrogen, have it fill up with blood ready to have a period, and never have it go through that cycle. So women were getting endometrial cancer, so hormones went off the market. But they thought, well, what if we give a synthetic, of course, patentable version of what the body would do, progesterone? And so they use something they call a progestin, which is not a progesterone, it's synthetic. And it has only one common feature with progesterone, in that it will protect you from getting endometrial cancer. In every other part of the body, and remember there was a long list of health changes that happen with menopause, in every other part of the body, progesterone actually does what we want it to. It helps us sleep better and have a better mood. Provera is the opposite. Progesterone can restore our sex drive. Provera is the opposite. Neither one of them really has. The breast tissue is really important. Progesterone stops the increase in breast cell production that can go out of whack with breast cancer. Provera is the opposite. But nonetheless, they thought Prem-Pro at least would prevent us from getting breast cancer. So let's give it a try. They thought, you know, we had trouble with just this plain estrogen alone. We'll give Premarin and Provera. 25 years ago, mid-90s, when this was the common solution, I had two concerns. Oral estrogen has never been a good idea, and we know now better why that is the case. And that is when you take oral estrogen, it has to go through your liver. Same thing is true for progesterone, but that's not so much of a problem. But when estrogen goes through the liver, it raises the level of inflammation and it accelerates the process of blood clotting in your blood vessels. So you're more likely to have a heart attack, a stroke, all sorts of things if you're using an oral estrogen. The progestin, as I said, it's a horrible drug, and I used to say I would only give it to Dick Cheney, and now I say that I would also give it to Donald Trump. But the bottom line is that neither one of these is bioidentical. Progesterone does go through the liver, that's what makes you more sleepy, but there's no particular adverse effect unless you get really too sleepy from having progesterone pass through the liver, unlike estrogen. There's been a lot of research into this over time. It was the 80s and the 90s when they were starting to really use this combination drug, and there were a handful of studies, and it seemed to be that everything was good, that hormone replacement therapy seemed to be beneficial with no downside, so long as you gave both these hormones. We needed to do better than that, and Powers That Be came up with a study called the Women's Health Initiative, which was started in 1993, and its intention was really that it was going to go forever, study a lot of factors about women and their health, enrolled 162,000 women. That is a huge trial. I'm in a trial right now. Our goal was to get 30 patients. I think I've got 6 here. Oh my God, I don't know who was managing 162,000, but way so many. And they came up with the Women's Health Initiative and enrolled all these women. Oh my God. I know, you know how people say they know where they were when JFK was killed? I know where I was when this press release came out. I was in Missoula, Montana, 2002, driving around with my friend Ann, also went to medical school, and with me, and oh my God, the NHI has stopped the Women's Health Initiative because there was an increased risk of invasive breast cancer. So everybody who'd been promoting this, the American College of OBGYN, the North American Society for Menopause, kind of everybody and their brother and sister, family doctors, public health, we have to take this off the table. And the prescriptions at that point, even though women really were by and large happy with their hormones, was that the prescription rate went down by about 70%. So all the benefits in all those body parts were lost to these women. Let's look more closely at this study. And I will say that some of the study is still ongoing. The only part of the study that was stopped was the people who were taking Premarin and Provera, because they did know, but they didn't put this in the press release, that the women were taking only Premarin. Now remember, that can cause cancer in the lining of your uterus, but if you've had a hysterectomy, that is the recommended treatment, just Premarin. They had no increased risk. So that part of the study kept going, didn't go in the press release. They noticed a little bit later that actually maybe those women did better. That has continued over time. And the group that was only on Premarin, let me look this up. Oh, let's see where I have it. They have a marked reduction in the risk of breast cancer if they're just on Premarin, which is a horse estrogen, not a human one. But the increased risk of combining both these drugs was 26%. That sounds really important. Like if you had a hamburger and you ate 26% more hamburger, well, that's not a lot, but it is significantly more, 26% more cake or something like that. But in the study, it was not statistically significant. So like what does that mean? How on earth does it happen? Well, when you're designing a study, first of all, you decide what's going to be statistically significant. But it's also true that there is a logic to statistical significance. If you have a study, and I'm going to round off these numbers just so you have, it's easier to talk about. If you have a 30% increased risk, that means if you have 10 women, you're going to have 30% more who have the problem. So it increases from 10 women to 13 women. Out of 100, that's a lot. 3 out of 100 women, 3% more of the women are going to get breast cancer. I mean, 10% are going to get it anyway, but 3 more are going to get it out of 100. But if it's out of 1,000,000 women that it goes from 10 to 13, that's why it's not statistically significant, because in the bigger picture, that's not a significant number. In this actual study, I think I might get to it, but anyway, the actual calculation was a 25%, about a 25% increase in risk. All the factors listed here, I know what I'm going to go back here. What the actual numbers was not 10 out of 100 or 10 out of 1,000,000. It was 32 women out of 10,000. And that number increased from 32 to 40 out of 10,000. Would you consider 8 more women out of 10,000 significant when really they might have better gum health, keep their teeth, less Alzheimer's disease, and not get osteoporosis? Reasonable question. And the book I'm going to share with you at the end here, he would say, that doesn't change my mind. I would still give my wife Premarin and Provera. Okay, but the Premarin and Provera did raise the risk from 32 to 40 women. So would all these problems, lifestyle choices. If you have more than 4 ounces of alcohol a day, that definitely raises your risk. And if you have 2 drinks a day, it doubles your risk. It's 100% increase. If you had French fries more than twice a week when you were a child, that's associated with a similar risk. If you eat a quarter of a grapefruit a day, that's a similar risk comparison. Weight gain, pregnancy or later, which actually, I'm not going to tell you necessarily to stop eating grapefruit, but I will say it's a good idea if you can be in your pre-pregnancy weight. If your father was more than 40 when you were born, well, what can you do about that? Antibiotic use, insulin resistance, and nighttime snacking. It's really great to prevent breast cancer and to prevent breast cancer recurrence to stop eating 3 hours before you go to bed. You've probably heard me say this. Women who work a different shift than the day shift and sleep at night, or any reason that people have sleep loss, will increase your risk of breast cancer. Why is this keep happening? I bet I'm right-clicking or left-clicking. Something that I forget, because I don't think any of you do this, is that smoking increases your risk of breast cancer. So the bottom line about breast cancer in the real world is that not getting breast cancer is a little bit luck. Exposures like your father being more than 40 when you were born, like you don't have any control over that. Some of it's genetics, and really not the BRCA gene so much. The BRCA gene has not increased since the 1920s, but our incidence of breast cancer has markedly increased. But it's mostly lifestyle. So what can you do in your lifestyle to try and not get breast cancer? You can have lots of vegetables. Specifically, cruciferous vegetables are good for that. If you don't like cruciferous vegetables, which you should cook most of the time, by the way, we have a nice supplement called Indole Forte, which has the anti-breast cancer nutrients extracted and combined out of it, and the dose is easy. It's 1 pill a day. It's really important that you eat organic food. Non-organic food has toxins in it. That puts a burden on your liver. When your liver's burdened, you're at greater risk of having breast cancer. So the same reason you shouldn't have processed food or eat trans fats or eat too many omega-6s puts an extra burden on your liver. And the main thing that puts a burden on your liver is alcohol. So despite the studies that supposedly drinking a little bit of wine every day reduces your risk of dying early or having a heart attack, I actually don't believe that. I think that if you wanted to be the healthiest person you could be, and it was not an excessive stress for you, I would say don't drink alcohol. It really doesn't provide any benefit if you take healthy people and have half the healthy people drink and half the healthy people not drink. It's better to not drink. That being said, if you're so stressed out that a little bit of alcohol at night really helps you unwind and enjoy the night with your family and go to bed early and have a good night's sleep, keeping your maximum to 8 ounces a day, 1 beer, 1 glass of wine, and not, this is not an 8-ounce glass of wine. This is a 16-ounce glass of water, but it shouldn't be a wine glass at night. Getting good exercise 4 days a week, sleeping well every night in the dark, and I don't mean just light dark, but I do mean, here's something I just learned. I learned that. Did I learn that this weekend too? Yeah. Outside lights can really interfere with your ability to sleep, particularly if you live downtown somewhere and you have neon lights coming in or car lights coming in, or even if the house across the street from you has a bright night light. But moonlight, even though it seems to really light up the world, is a low enough lux reading. And if you want to know how bright lights are, you should get this great app on your phone, which I believe is called My Lux. Well, there it is. It is called My Lux, and it will register the light that you're exposed to, and you'll see that even though a moonlit night and a cloudy day seem the same, a moonlit night keeps you below 40 lux, which is what we should be at for several hours before we go to sleep at night. Check your living room, see what kind of lux level you're sitting in at night before you go to bed. And lights from the outside, lights from a cloudy day, lights from a bright day, send that number off the meter, have it go quite wildly. And you want your vitamin D levels to be on the upper side, 50 to 80. More lifestyle protectors are the overnight fast, which I mentioned. There's a lot of talk that there is a benefit to doing some degree of a prolonged fast. We might have one of those group medical visits on that topic. And in the seminar this weekend, there were two speakers who really said that, a 24-hour water fast every so often, every week, if you're really into it, every month, 4 times a year, anything like that has a real benefit that is so complex and interesting. It is really valuable. Should floss your teeth every day and not use antibacterial mouthwashes. You'd want to select the bacteria you have in your mouth. Don't feed them sugar. Don't kill them with Listerine. Choline is really important to reduce your risk of lifestyle, which you get from egg yolks, liver, or choline if you have to take it that way. Get enough iodine and selenium. So iodine is, I like the one at our local food co-op that's liquid, and 1 drop is the right dose, which is less than 0.5 milligram, which really should be enough. There are iodine advocates that recommend 12 to 15 milligrams a day. I actually suggest you should have some way of taking 12 to 15 milligrams on hand at home in case Fukushima blows up again and there's a nasty wind blowing radiation over that way. That's the level of iodine you need to protect yourself against radiation. I don't think you need it every day. That's my point. Omega-3 fatty acids. So if you're not eating fish regularly, please take an omega-3 acid supplement. So those are all the things you can do, but what about hormones? Are they a good idea or not a good idea? So I want you to really remember that Premarin alone had no increased risk of breast cancer, and that marked change became even more marked over 18 years. The risk of breast cancer in women who took Premarin, just estrogen, versus nothing, their breast cancer risk was reduced by half. By half. So you're better off actually taking estrogen. You have a uterus, I can't give you just estrogen, and I wouldn't. But that's the, oh, by the way, correction to that giant press release that came out in 2002, and you've never seen this in a headline. I do believe it's important to be cautious with hormones. I believe they should be bioidentical. I think that estradiol should be applied to the skin so you don't get that liver effect of inflammation and a tendency towards blood clotting. I think it's better for you to use progesterone rather than Provera or Progestin, because this does have kind of a protective effect on the breast. Those big studies have not been done because it's not such a patentable molecule. Whereas the estradiol in a delivery system of a patch, that is patentable, so that has been studied a little bit. There have been a few studies on progesterone out of France particularly, and it does appear to be either neutral or beneficial. There's a separate estrogen called estriol, the one that you make in pregnancy at really high levels. It's a very weak estrogen in menopause, but it is really great for the urinary and vaginal mucosa. And then for women, I also recommend they take testosterone, and it helps with bone strength. And remember, I said breaking a bone, I think, is the worst thing that can happen to you, and your sex drive and your brain. So what do these hormones that I recommend help with all these, how they help with these conditions? So it's pretty well agreed that they help with hot flashes and insomnia. And if you actually have insurance, I can just put down hot flashes. Vasomotor symptoms is how you say it in medicalese, and your insurance will pay for it definitely up to the age of 60, and some insurances will pay for it up to the age of 70. Everybody agrees that can help with mood and cognition. Okay, well, cognition is an interesting one. Let me go backwards there. Because so impaired cognition at its worst expression is Alzheimer's disease. And we knew that there are estrogen receptors in the brain, and that the brain benefits from having those estrogen receptors activated, and we think better. But there was a concern that if you stopped your period, say in your late 40s or early 50s, and didn't take hormones and started them late, that you'd missed the window of opportunity and the brain cells had completely lost their ability to respond to estrogen, and you weren't going to do well if you started it later in life. In May, now 2 years ago, a group out of Korea published a study where they took estradiol on the skin, the way I give it, bioidentical progesterone, orally the way I give it. And they didn't have very many women, and you have to start these kind of things small. They had 37 women, and they divided them, and half of them did not get hormones, and half of them did. These women were as young as 57 and as old as 82. All these women had some degree of cognitive impairment, and they were treating it other ways too, but they just wanted to see if you kept the groups the same, did the estrogen make a difference? It made a huge difference. There was a significant less decline and some improvement over 2 years in these some elderly women starting on hormones compared to the ones who didn't. So if you're 80 and you're thinking about taking hormones and you haven't, I would encourage you to jump through all the hoops, which I'll tell you about in a second, and try them. And you will know within 3 to 6 months if it's helping you or not. And if it's not and you have great bones, I wouldn't keep encouraging it. But really important, and the only time I've really seen bone density improve is taking hormones in the setting of osteoporosis. Cardiovascular disease is a little bit more of a mystery. That's one where it is definitely true that it should be initiated at menopause and continued at least 10 years. But the only studies that have really been done that long on cardiovascular disease are the ones that have a nickel to gain. So that would be Prem-Pro, which I would not recommend. Any estrogen will help with gum and dental issues. Premarin, estradiol, whatever. It improves the circulation to your gums, helps them adhere to your teeth, keep your teeth, chew, use those teeth. They help your brain. And really, I think when you look at the sum of data that's in, you kind of have to say that breast cancer is either neutral risk with hormones or a benefit. So, bottom line, the way I see it, that the benefit is much greater than the overall risk. Particularly for the breast, estradiol is protective. I believe the literature about progesterone says it's either neutral or a slight improvement, but the numbers don't come anywhere close to the 26% increase in the thousands of women in the Women's Health International study. So there's nothing to really compare if you've got a scientist who's arguing with you that the progestin is the problem. You know, for some women, progesterone itself is a problem. It does have a brain effect, and for most women that's welcome. They sleep better, maybe they think better. For about 10% of women, progesterone is depressing. And I didn't see this for the first maybe 10 years that I practiced, but I do see it occasionally now. And there are ways around it. There's about 10 ways around it. Depending on whether or not the woman has a uterus, then we just don't give it to her. If she has a uterus but gets terribly depressed when she takes progesterone, you can just take it a week out of the month or 2 weeks out of the month, or even 2 weeks every 3 months, or you can take it on the skin or vaginally, and then that doesn't go through your liver and you usually don't get that mood effect. So there's a lot of ways around it, but most women like that swap of putting in progesterone and taking out the progestin, or not having anything in there. There's a cost to hormones and a hassle. Even if you have great insurance, and particularly right at menopause, a lot of women might have great insurance and have it be completely covered. But it will get more expensive as you get older and your insurance stops covering it. I work my best to find out the most affordable way of getting it. It's ironic because it was the progestin that caused the breast cancer in the Women's Health International study. 75-year-old woman, her insurance will still cover progesterone. It just won't cover estrogen. So there's ways around it. You know, I used to use Canadian pharmacies, and those became slightly more expensive and more of a hassle. And now I recommend women get the Good RX app on their phone, and at some pharmacy local to them, the estrogen is going to be about $30 a month. So just the hormones are about $60 a month. I like to make sure that we're doing this safely. That's the hassle part. The estrogen goes through your liver. If you're also drinking alcohol, using pesticides, living in the Rogue Valley, which has horrible air quality, even though it is spectacularly beautiful today, your liver has a lot of work to do. And if it gets backed up, estrogen's the least toxic thing it's dealing with. It's going to leave estrogen around, and certain steps along the estrogen pathway of metabolism, certain steps are carcinogenic. So I want to check, are you metabolizing your estrogen well? And if you're not, there's ways we can modify it. I also want to the other hassle with prescribing hormones is, so if you need penicillin, we know the dose you need of penicillin. If you decide you want estrogen, I don't exactly know the dose you're going to need. I'm pretty good at guessing. And I can start out really gradually with people and slowly increase, or I can start out where I think it's going to be and go up or down. My gold standard rule of thumb, what other phrase can I use like that? But really the way I approach hormones is, we agree that we're going to work on this together. We're going to stay in communication about this. And first, we're going to make you happy. I give you the hormones. I think it's a great dose, theoretically, but it's not relieving your hot flashes. We're going to give you more. You got terrible breast tenderness, we might take down one of the hormones or actually increase the other one. Sometimes it's just the imbalance between the hormones. So we get the hormones to a point where you're happy. Then I need to be happy. And for me to be happy, I need to know what your blood levels are in relationship with each other. I need to know that you have some kind of breast imaging every year, because if that estrogen is unbeknownst to us backing up in your liver somehow, then those mid steps in the estrogen metabolism, not so much the level in your blood, but the way the metabolism is going, can increase your risk of breast cancer. We should just be careful. I like you to do the test for the estrogen metabolism, which is a urine test and is not covered by insurance. And, you know, I like the idea that somebody gets a pelvic exam every year or two, just to know that we're working with everything physically intact as we want it. So that's a cost, that's a hassle. But I'd say for 90% of the women for whom I prescribe hormones, no problem, I'll do it. What do you want from me? I'll do it. Because it's a huge quality of life improvement. You know what I don't think I have a slide about, but I'm going to say it here. I'd say the main problem, and it's usually because we've gotten things out of whack a little bit. We haven't checked the lab values, or we haven't checked the estrogen metabolism, is bleeding on the hormones. If you start bleeding in the first couple months of taking hormones, it's usually just an imbalance in the dose, and we check it and fix it, and that usually goes away. If it persists, that involves a whole evaluation that would be better if you had insurance. It involves a gynecological exam and an ultrasound and maybe something like a DNC. And I went through all of that, I guess it was last year. And yeah, it was a hassle for a day of a doctor's appointment, a day of the DNC. And it means I can take hormones without bleeding or worrying about what's growing in my uterus. I mean, I still have it, but it's not misbehaving anymore. For the rest of my life, it was a price well worth paying. So I should put that on the slide too, but I didn't. So I hope you just heard it. I don't want to take hormones, or I can't take hormones. You know, there really are some women I try with hormones and we can't find something that works about them for them. So they want an alternative. And there are alternatives that have not been nearly as well studied, with the exclusion of one, which we'll get to. But there are many people who report symptomatic improvement from using some form of soy, and particularly the extract of soy that is put in capsules as genistein. We know genistein, and I use this for women who can't take hormones or for men who have really low estrogens. It activates the estrogen receptors in the brain. So if you're a woman who cares about her brain health, but does not want to take hormones for whatever reason, it's your decision, no pressure. Yes, pressure, but I listen. Genistein, I would recommend for those women for their brain health. There are herbs, and I used Semisafuga for hot flashes for myself and my patients for a while, until really, as I say, the mid-90s, I became convinced that I'd be doing them a better favor if I put them on hormones. And the question is, these all have definite help with hot flashes. The genistein definitely can help the brain receptors. And the rest of them, they have either milder or unknown effects in every other way. So some of the soy products have been studied somewhat for osteoporosis. In cardiovascular disease, I'm not aware of any studying in gum and dental issues. And soy has been shown with flax, which doesn't help in other ways, to be helpful with breast health. So yes, there are some alternatives. This is a great book. It's very readable. I recommend to everybody. And this author, Avram Blooming, he's an oncologist who used to keep women off of hormones, including his own wife when she was younger. Carol Tavris is a feminist sociologist, statistician who was opposed to hormones, but they got a bee in their bonnet and they thought they should investigate it. Came up with a book that in England, or by paperback, is called Estrogen Matters, pronounced the British way, which is really Estrogen Matters, I think. Great book, but he summed it all. He says, you can read my book, or you can know that you should only consider hormones if you want to look better, feel better, and live longer. If that's not on your list, then forget, you don't need to consider hormones. Oh, right, men. So at the very beginning, I said that men don't go through menopause, and that's pretty much true, but it's also true that men can have declining levels of testosterone, not at all as precipitously as we go through in menopause, but they can get lower levels of testosterone. And just as it does in smaller doses for women, I give about 20 times the dose to men, it can help with cognition and mood support. It can help men strengthen their muscles. And so some guys, oh, I just tired exercising, I can't build the body, you know, and there are even commercials for this on television. I don't even really know what they're advertising, because they're not advertising testosterone. You know, I've got bigger muscles now that I had my tea booster. Well, I believe in boosting tea with tea itself. Anyway, strengthens your muscles, and the way testosterone prevents osteoporosis is that when you have stronger muscles, you get stronger bones. Here's something about working out. If you exercise vigorously, we believe that if we exercise vigorously, we'll get stronger. Here's the way that works. You exercise vigorously. In the process of working out hard, you actually injure that muscle. And over the next day or so, your muscle decides whether to try and just chill and maybe put some Band-Aids over this, or to become stronger. Testosterone, adequate protein, recovery between exercise enable your body to decide, I'm going to replace that damaged muscle with a stronger one. So let me say those three elements, and there's a couple more, but the strong ones are testosterone. DHEA is also a good approach to the hormonal part of this problem. Adequate protein. I pretty much guarantee you that none of us, including myself, are probably eating an optimal level of protein for making strong muscles. And then the hormonal support so that your muscle can repair itself, and that these strong muscles can then pull on the bones, and the bones respond in the same way the muscles do. Whoa, that pull from that muscle seems kind of intense. I don't want to break. I want to make myself stronger. Women benefit from testosterone by having less body fat. Men, we actually have to be careful, because if they have body fat, belly fat particularly, not love handles, that's a different issue, but the belly fat that makes them look pregnant, they'll take their testosterone, turn it into estrogen, and be at risk for prostate cancer. They need some estrogen for their bones and their brains, but not too much. So, but in women, it'll help you have less body fat. In menopause, helps both sexes with libido or sex drive. Men's frequent concern later in life is the loss of their erections. Testosterone doesn't really help with that unless it's a desire issue. But that's a circulatory problem that's indicative of some vascular disease. Testosterone won't help with that. And then gives everybody healthier hair and skin, because connective tissue is part of that. There's lots of other hormones beyond the sex hormones, but that is a tale for another day. So now we're going to open it up to see where we have questions. I'm going to stop sharing the screen, and I'm going to open up the chat. Or Rachel, if you know something I want to do, talk about, isn't it a 30%? Aha. Somebody asked the question about the statistics thing. Isn't a 30% risk for 100 women 30 more, not 3 more? So the risk is calculated on the percentage of what is the risk without my intervention. And in this example I was giving, the risk was that 10 women out of 100, or 32 out of 10,000, which was the number in the study, are likely going to get breast cancer over these 2 years, no matter what we do. The 30% is an added risk. So it's not a 30% risk, it's a 30% increase in risk that the hormones convey. And I've heard now from 2 people. So if that's clear, Rose, if you're still on the call, if not, please write another question. Okay. Anne from Anne, and I've heard this from 2 people, that you can't use your Medicare and your GoodRx estrogen discount at the same pharmacy. I guess a pharmacy, and this is true in doctor's offices, if I accept Medicare and you have it, I have to take it, and I have to charge Medicare for everything, and I don't do that because they wouldn't pay, they'd pay me for 10 or 15-minute office appointments, which we can't do it that way. So a pharmacy probably, if they know you, so I guess it's a little bit of deception. But you're going to I walk into Rite Aid, where I don't buy any of my other prescriptions, and I say, I want to buy this prescription that someone's called in for me, and I want to use my GoodRx app, and they don't ask about insurance if you don't bring it up. Is there a different effect on hormones if you are a vegetarian versus an omnivore? Can vegetarians take hormones? And the answer is, so vegetarians might, if they eat a lot of soy, have a tendency to feel, remember that's an alternative treatment to estrogen, they might feel a little bit less that they less need hormone replacement. They may not have as many hot flashes. but soy does not take the place. If I do a blood level for estrogen of one woman on a patch and one woman eating a lot of soy, the woman on the patch is going to have an estrogen level similar to some point of her menstruating life. And the woman eating a lot of soy is going to have the estrogen level of a less than her husband who has belly fat and is making estrogen. That is a funny, I mean, how ironic. If you take two 60-year-old average American people, men tend to have more abdominal fat than women because we had good hormones keeping us metabolically healthy into our 50s. And he will have more intra-abdominal fat. You take these two 60-year-old people, that man's going to have a higher estrogen level than the woman is. So a woman who's not menstruating, not taking hormones, or using soy as a hormone alternative, they're not going to have the estradiol level. And as I said, the soy benefit, we know that there is some benefit to relieving symptoms of menopause, probably some brain benefit, and maybe a little bit of bone benefit. Question, what do I know about 2-MeO? I don't even know. Oh, I know what they're talking, what this is. That's close to what it is. So when estrogen goes through your liver, we have 3 estrogens in our body. I prescribe for menopause, the hormone that's dominant earlier in life called estradiol. Oh, I was going to say, I didn't finish the vegetarian omnivore thing. Omnivores, because they're eating lots of animals, and particularly if they eat nose to tail, they might tend to have slightly higher hormones in menopause than omnivores. Carnivores would have slightly higher ones than omnivores, who would have slightly higher ones than vegetarians. Meat, particularly if you eat crummy, industrial meat, will have hormones in it, but any meat is going to have a whisper of hormones in it. Okay, that was Rachel's question. 2-MeO as a protection against breast cancer. Okay, back up. We have 3 estrogens in our body. Estrone, which is without hormones, the main hormone in menopause. Estradiol, the main hormone in most of your menstruating life, and estriol, the main hormone in pregnancy. And they all have different benefits, but it's the estradiol that has all the benefits we were talking about. Primarily, as it goes through your liver, it gets metabolized to estrone, and then estrone can take a variety of pathways, and this is why I ask women to do a urine test several times to check their metabolic pathways. And one of them is going down a pathway where they go to either 2-hydroxyestrone, 4-hydroxyestrone, or 16-hydroxyestrone. 2-hydroxyestrone, which I think is what's meant here by 2-MeO, I'm not sure, please Tina, let me know if it's different than that, is protective against breast cancer. 4-hydroxyestrone is the most concerning because it is actually a pro-carcinogen and needs metabolism by 2 more steps. It needs you to have active methylation, and it needs you to have an abundant supply of glutathione, the main antioxidant in the body, to be metabolized and get out of the body. And 16-hydroxyestrone is also pro-carcinogenic, but the way you can encourage your body to take estrogen down the 2-hydroxy pathway is to eat lots of cruciferous vegetables or to take that supplement we have called Indole Forte. So Tina, please let me know. I guess I will look up who Dr. Lindsay Berkson is and see if it's something else. 2-MeO is a different compound. Okay, great. You let me know more about it. Anna asks, are there any risks for men if they come in contact with estriol cream? That is such a weak estrogen. Probably not much. That said, so women, I typically recommend they use estriol vaginally. And I'd say, if you know you're going to have sex and use your estriol cream that night, use it after or skip a night, something like that. It would be, you'd have to have really strong estriol cream that I accidentally wrote way too strong. And you'd have to put a lot in for a man to get contact with either his skin or his genitals and have it be a problem. It's usually not a problem. And it is frequently, so I said on the very first slide that it's common for me for people to come back and have their sister, their cousin, or their other doctor say they don't recommend hormones. And, I just encourage them to, so if I don't do pelvic exams anymore. So I do ask women to go somewhere else for their pelvic exam when they need it. And it's not uncommon that their doctor will say, I don't recommend it over the age of 60. And then I think, how are you going to deal with that? If it's someone who wants to talk, you say, I know you really mean your best for me. Thanks, Tina. I got that link. I'll look it up. I know you mean your best for me, but I've been working with Dr. Gordon for decades. She's put a lot of study into this, and I have confidence in her recommendation. And let me know if it's a problem. And actually, Susan, from the clinic you went, I think I have a little bit of an inside edge. I could maybe have an influence there. But it's not uncommon. Even the gynecologist who I went to for that day of procedures I told you about said, I typically don't recommend hormones for older women, but I have and she had some way of talking about that. I can't remember. I have my 70-year-olds, I'm thinking, she's looking at me, I'm 70, who just love their hormones. And I'd have to say, I'm one of them. So what we didn't get any suggestions for was any subjects for more controversies, but we're happy to get emails at info@Northwest Memory Center. We're having a lot of fun doing these Zoom meetings and seeing names of people we know and people we don't know. And welcome, any topic that I actually have something to say about already or would love to learn about. Tina volunteered here. And let us know if there's anything else you'd like to hear, any particular controversies or any group medical sessions that you might like to be a part of. And I'll see you back in 2 weeks. Thanks, everybody. Bye-bye.